Good morning, my name is B. Moorhead, and I'm the Director of Texas Impact, and we are testifying for the bill, enthusiastically for House Bill 3195. House Bill 3195 would not solve all of Texas's health insurance problems, but it would, but it would provide health insurance for some Texans, and in doing so, it would help you as policymakers take a next step toward finding a workable solution to help our state address its health insurance issues. The money in the Premium Stabilization Fund was intended to provide health insurance for a limited population of people with special needs. Now that that particular program has gone away, it makes sense to use those funds to provide coverage in a way that will help move the state forward in its broader search for market-based solutions to health insurance for all Texans. A large body of research shows that parents' insurance status impacts children's health and health status regardless of whether the child has insurance, and this is particularly true for mothers. A study published by the American Public Health Association found a direct relationship between mothers' health insurance coverage and children's health outcomes. The study showed that children who live with uninsured mothers were significantly more likely to have poor health, less likely to use preventive care, and more likely to use emergency rooms, which are the most expensive form of care. The study concluded that mothers' lack of health insurance negatively impacts children's health, and it also reduces the probability of children's use of preventive care. Therefore, policies and programs designed to address children's health and well-being need to draw on a systems approach and account for the entire mother and child system to be effective. One report concluded, neglecting financial access to care for adults may have the unintended effect of diminishing the impact of targeted health insurance programs for children. HB 3195 would establish a targeted pilot that would provide insurance for some low-income parents who are uninsured, but whose children are enrolled in a state health insurance program. The pilot would conclude, importantly for you all as policymakers, with a report that would evaluate the impact parental coverage had on utilization and health of children in state health insurance programs. The bill is not prescriptive, as previous people have said, as to program structure. The Texas Department of Insurance has a lot of experience developing market-based programs, and the bill wisely leaves the details of this program to the agency. It does provide for the Health and Human Services Commission to include the pilot in the 1115 waiver renewal application. That makes sense because it would allow Texas to match the high-risk pool money, which otherwise will just be used dollar by dollar, and allow those one-time funds to go further. HB 3195 proposes a limited program that helps a limited number of people with a program with a problem that many Texans face. In doing so, it would help the state explore options that will meet our insurance needs in a broader way. It's important for the state to build the model and to develop the pilot in this case because this is a demonstration of a strategy that might be more widely applicable. We sometimes lose sight of the fact that the reason we have the waiver programs from the federal government at all is that it's in the federal government and the state government's interest to try out strategies before we sort of take them big in locations and see how they work. So the existence of a local community stakeholder group is very important, but it's equally important that the state agency be in charge of administering a program if the idea is to see how it would work on a broader scale. This is a great idea. I think it's a great idea to use lessons and leftover funds from the past to sow seeds for the future, and I hope that you will consider supporting House Bill 3195. Thank you.
Great. And what is Texas Impact?
Texas Impact is a statewide interfaith organization. We have members that are the denominational bodies of a number of Christian denominations as well as Jewish and other organizations. We have more than 35,000 network members all over the state, and they very much hope that you'll support this bill.
All right. Thank you so much for being with us.
Thank you.